Now, one of the things that's super interesting when it comes to concussions is innovation. So, this is a cool thing that I tell my patients all the time. The things I do with you today might not be the things I do with you tomorrow, which is a true statement with concussions. We are learning so much every day, every year about different therapies, different practices, different ways that we can push the brain, push the head, push in that rehab. So you always have to be kind of continuing your education in terms of learning what's new, what's coming out, what new devices have been invented that we can kind of use therapeutically, and you got to leverage those to your abilities. So potentially when you're dealing with someone who's a little bit more of a complex case, if you're not able to help them on that very same day and you keep advancing your knowledge, maybe later down the road there'll be something new that you can try on that can be super helpful. Another thing to keep in mind is what kind of tools, what kind of knowledge you have at your base that you can help these patients with. So, in terms of my patients themselves, I have several different kind of tools that I use with my patients to help push them in different ways. Now, one of these things might be effective with one patient, but absolutely ineffective with another. So you have to be able to pivot quite often depending on the individual's needs. So, another thing that I like to do with my patients is combining different therapies. Sometimes, if one therapy alone isn't working, you can kind of combine that with another thing, pushes the head and the brain a little bit harder, and that will have the resulting effect you're looking for. But complexity is not always a solution. Sometimes you'll find the simplest of exercises can be the most effective for helping someone recover from a head trauma. So if you make things too complex, it might be a little bit too difficult for that patient's head at that very situation to handle that therapeutic activity, making the exercise itself not very effective. So you really have to be able to change things and modify things according to that patient's needs, and that's kind of how you're going to find the best results. But you always have to stay current with what's coming out because that's really kind of what gives you that edge on top of everyone else in terms of really knowing. Sometimes there's other things you can do that maybe you didn't know before that can be super helpful, kind of getting the patient to the next stage.